Many of us spend our birthdays crossing things off our bucket list.
For a 100-year-old woman in North Carolina, her next venture was going to jail. Ruth Bryant is her name. She said she had always wanted to go to jail, but had never been. But this year, for her birthday, the local sheriff's department arrested her at an assisted living center in Roxborough, North Carolina.
Are you Miss Bryant?
Oh, depends on what you want.
Oh, depends what I want. I want you.
You went to the fire department, showed yourself a couple weeks ago.
I know she's 100, but I didn't know they would be going this far.
Anybody will go to jail for showing themselves. I can't believe she showed herself. My goodness. Okay, the birthday girl was happy to finally wear an orange jumpsuit. She only spent a few minutes, though, in that cell. But my goodness, okay, she got her wish.
I saw her kick at him.
Yes. Well, what a production there. Okay.
That's a great story.
All right, so cute, so cute. All right, it was a weary night for one clumsy criminal, a real one, in Vallejo, California.
Yes, the man surrendered to police after running, wrecking, and tripping. The Solano County deputy tried to pull over 38-year-old David Lee Jones Jr., but he sped off. He hit a curb and lost a tire, but he kept going. He leapt out of his vehicle and landed face first on the ground, then sped off running. Deputies didn't have to search too far to find him.
I come to the front of the car, I'm like, wait a second, I think that's him, like he's all cut up and scraped.
Jones was just sitting on that front porch as you see him there, awaiting his arrest.
What's your guess? He might have been under the influence of something.
It's possible.
Yeah. Okay. All right, that does it for Channel 2 News at 4.
Channel 2 News at 5 begins in just 60 seconds. Don't go away.
3698. Channel 2 News begins right now with breaking news.
Breaking now at 5, health officials have announced 2 confirmed cases of the coronavirus in Harris County.
And right now we are awaiting a news conference from city and county officials. And this news comes just one day after Fort Bend County reported that a man out in Stafford is believed to be the county's first coronavirus case.
Channel 2's Joel Eisenbaum is live now at Houston TransStar, where we expect the news conference to get underway at any moment. Joel.
Lauren, I think that news conference was actually supposed to start at 4:45, but I think we're still awaiting the arrival of some of our dignitaries. This will be hosted, this news conference, the update on coronavirus, by both Mayor Sylvester Turner and Harris County Judge Lena Hidalgo. Joining them will be the top doctors and health officials with both Harris County Public Health and Houston Public Health. Again, we expect this to start any moment, just inside the doors behind me. Let's give you what we know right at this moment, and it's pretty thin information, but important nonetheless, and that is there are 2 people who have been confirmed in Harris County as having coronavirus, so-called COVID-19. And those test results, what's different here is those test results are backed up by the CDC. The patients are a man and a woman from Northwest Harris County, and these 2 cases of coronavirus are travel-related, we're told. There is no evidence of so-called community spread at this point. We would hope that these people have been isolated, but at this point have not been given any information. We also don't know where they contracted coronavirus or where they're being held right at this very moment. Those are answers we hope to get in just a few minutes at this press conference, which again was slated to begin just about 15 minutes ago, and we're hoping will start any moment. For now, we're live at TransStar. I'm Joel Eisenbaum, KPRC Channel 2 News.
All right, Joel, thank you so much for that update, sir. Meantime, in just the last couple of hours, we have received new information about a Stafford man who is suspected to be Fort Bend County's first case of the coronavirus. Told that man is in his 70s and he traveled overseas and went to the hospital when he felt sick. Health officials say they have identified 10 people who had close contact with that man, all of them now self-quarantining. If they do show symptoms, they will be tested for that virus. Tonight, we've also heard from KPRC Channel 2 viewers who want to know answers to crucial questions. Things like which airport did that man use and where exactly does he live? But the county's health department says they will not be releasing any of that information because of privacy laws.
There's HIPAA, there's a couple of state mandates that we just cannot share personal information about this individual. And just remember, this is one case. You know, there's any little information that we do share, it's going to point to this one individual. And right now, we just did not want to do that.
The CDC in Atlanta will confirm if the man has the virus, but local officials say they have no reason to suspect otherwise.
Governor Greg Abbott says 10 testing labs are being set up in cities across the state. The test is done through nasal and oral swabs. The ability will shorten the time for test results, but it may be a while before some people can get tested.
The state lab can perform approximately test for 26 patients per day. Houston and El Paso can perform tests for approximately 15 people per day. The State Public Health Lab Network will be able to process more than 125 COVID-19 tests per day.
Specimens from the Fort Bend County man were tested at the Houston Health Department laboratory, and the results came back in less than 24 hours.
And we want to go ahead and get back to Houston TransStar. We're told Harris County Judge Lena Hidalgo is talking about the 2 cases out in Harris County of coronavirus. Let's listen in.
Dr. Plasencia, who's with the State Health Services, and Dr. Minter with Fort Bend County Public Health. We have received confirmation this afternoon of the first 2 confirmed cases of coronavirus in Harris County. That is a man and woman who are both, along with the Fort Bend case that was confirmed yesterday, these folks were all part of a trip to Egypt. They are part of a larger group that we're aware of that are now under self-quarantine and have been under self-quarantine and are being tested. The man and woman are both in the hospital in stable conditions. What I want to clarify is we've been treating all of the folks associated with this trip as presumptive positives in a way. We have been asking them to self-quarantine. We have been mapping their networks, where they've been, and reaching out to the folks they may have come into contact with to make sure that we are still containing the spread of this. This is just the first 2 cases. We expect to see more in the coming days as we receive test results back. But know that we are very much in the containment phase. I will note as well the patient, one of the 2 folks who were confirmed positive today is a Rice University employee, and there will be a statement, I know, from the university coming out later today. As far as what we're doing differently now that we know we have these 2 confirmed cases, we'd been treating them, as I mentioned, as though they were already positives and reacting to doing the mapping work appropriately. We are speeding up our reporting period and all of our systems here at the Office of Emergency Management. As you all know, we activated on Monday formally to level 3. We've been running exercises and updating our plans for weeks now. And we are now growing the number of folks that will be at the Emergency Operations Center every day. We will be continuing to work very closely with our hospital system, very closely with all our partners from the city of Houston to the school districts to all the folks that make sure that our community runs well, so that we can all prepare for whatever might come next. But it's important to recognize that the real next level of concern is if we were to start seeing cases that we can't trace back. Both of these cases and the case that was identified last night in Fort Bend County, they're all travel-related cases. So none of these are, unexplainable. There is no community contagion. There is no indication that they may have contracted this even on U.S. soil. So that's good news for us, because we have a close loop of people right now that we've identified, that we're following up with, that we're informing they may be exposed, and we're continually trying to identify if there's anybody else. So it's a containment phase still that we're on. Every resident in Harris County, in our region, is ultimately part of our public health team. We all have to do our part, and our part right now continues to be to wash our hands, to not sneeze or cough into our hands, to stay home from work or school if we feel sick, and to continue to pay attention to the news. We are governed right now by transparency. All the information we're sharing with you guys is the information we have confirmed. We will not be providing information that we have not confirmed with the Centers for Disease Control, but everything we know for a fact to be true, we are sharing with you because we want to make sure that the community is informed. As we receive any more positive cases, we will share that with the community. If we get to a point in which we are seeing cases that are not traced back to particular travel, to particular reasons for these people to be infected, we'll share that with the community as well, and that will indicate a new phase in our response. But right now, we're in the containment phase. We need to all continue to be vigilant. The city, the county, Fort Bend, and other counties, all of our health departments are working very closely together across departments, also within each of our entities and with the healthcare systems to make sure that we're responding and that we're prepared for if this issue were to grow, if we were to see more people affected. We are working through all of those contingencies. What would we do if we saw a significant number of people affected? How many tests do we need to be able to have in order to do that? What about folks who are affected who need to be quarantined but are breadwinners? We're asking all of those questions. What about public transit? All of that we're discussing, we're rehearsing, and we're trying to prepare as best we can. I'm going to repeat my remarks in Spanish. Then I will welcome Dr. Shaw to speak and share from his public health standpoint. Then the mayor will speak, and finally Dr. Peirce with the city of Houston. En español, entonces, estamos aquí presentando que esta tarde hemos confirmado los primeros 2 casos del coronavirus en el condado Harris. Son una mujer y un hombre. Ambos han viajado con el caso que se identificó anoche en el condado de Fort Bend. Los 3 fueron parte de un viaje a Egipto, donde entendemos se contagiaron con el virus. Entonces, hay más personas que fueron parte de este viaje, todas las hemos identificado hasta donde hemos podido y hemos venido hablando con ellos por los últimos días, antes de siquiera haber recibido un caso positivo, para entender dónde han estado ellos.
And you were listening in to Harris County Judge Lina Hidalgo talking about the 2 confirmed cases of coronavirus here in Harris County, also mentioning that presumptive positive case out of Fort Bend County is all one and the same as far as the trip is concerned. These 3 individuals went on a trip overseas to Egypt.
We understand this is a man and a woman in Harris County who are the 2 confirmed cases there, and a man in his 70s, also a presumptive case in Stafford. We understand they were all part of a group traveling that just recently returned back from Egypt. We're listening into this news conference now from Transtar. We're still going to hear from Mayor Turner speak. We're listening in from Judge Lina Hidalgo right now. She's addressing Spanish speakers. And also we're going to be hearing from Dr. Shaw on the public health concerns of this.
Some of the other interesting tidbits as being offered up during this conference. She did say that the 2 individuals out of Harris County are in the hospital right now, listed in stable condition. As far as the county is concerned, we're being told that they're in the containment phase. One of the other bits of information she did tell us is that one of the patients, a man, is a Rice University employee that has been a confirmed case, and we are expecting a press release or an update from Rice University as well.
She said that they're basically in their containment phase right now. So they're trying to contain these individuals, make sure that they don't expose anyone else. They're also trying to kind of map where they've been and map where these people have come into contact with other people as well, to kind of let everyone know. But again, we know that Rice University, we're expecting to hear from them, since it apparently is one of their employees who has now been one of the people tested and confirmed positive for coronavirus.
And perhaps a difference here for people who ask the question, what's the difference between the 2 in Harris County and the one out in Stafford? Well, the ones here have been confirmed by the CDC. The one out in Stafford, the individuals there, or the county officials, are still waiting for that confirmation from the CDC, which is why it is still considered a presumptive positive. They are going on the indication that perhaps it is and treating him accordingly.
And apparently it sounds like there were other people people on the trip that they had been to Egypt as well, and they are self-quarantining right now just to make sure that if they do come down with this, they don't expose other people. And they're, again, trying to just contain these people and make sure that everyone around them is safe and not exposed to this as well, kind of mapping their network and where they've been.
In fact, county officials here in Harris County have said that they're at a level 3 activation once they went into play just a couple of days ago, essentially meaning that they are on high alert, they are monitoring the situation, folks are there and keeping a close eye on how things develop. But at this point, there doesn't appear to be a concern of a spread throughout the community necessarily. They've got their eye on everything right now.
And the presumed positive case in Stafford is also a man. We're told that he is in his 70s. He is also in stable condition, being treated at a hospital as well.
And as Lauren mentioned, that all these individuals were in contact with other people. There were a lot of people, as we understood, that took this trip overseas to Egypt. And as we understand, as it pertains to the gentleman out in Stafford, he had been in close contact with about a dozen or so people. And as we understand right now from officials, they are all self-quarantining. And of course, if they perhaps show symptoms, then at that point, they will certainly be tested for the virus.
We were listening to the fire chief earlier out in Stafford, Larry D. Camillo, and he was saying that this patient, the one that presented out there, basically had difficulty breathing, and that person was eventually treated at emergency room, and that's when a doctor said, hey, let's test and see if we have a coronavirus case here. I think that they had also asked the patient if they had traveled at all, and when it was confirmed that they had been to Egypt, that's when they began to suspect that possibly the coronavirus could be to blame here. And so presumably that's probably something that a lot of patients get asked right now who come to the hospital with situations, respiratory type issues. You know, it's flu season right now, so people are still going to hospitals and what have you for that. And so that's something that doctors right now are asking about, our people if they've been traveling.
All right, tell you what, we're going to go ahead and listen back into county officials updating folks on Harris County
providing
cases.
This important information to our communities. My name is Dr. Umair Shah. I'm the Executive Director, Harris County Public Health and the Local Health Authority for Harris County, and I'm pleased to join Mayor Turner here and certainly our colleagues in public health. And I think Judge Hidalgo has provided all of the information that is really important for our community to know. Let me just reemphasize a few points here. First and foremost is that we are aware and have been investigating, along with our regional public health partners, individuals who went on a trip to Egypt, and based on that travel exposure that occurred overseas, not here in Harris County or our region. Let me make sure that's clear, that the travel exposure was overseas and not here in Harris County. Out of additional investigative steps, we were able to determine that there was a link between the individual who was confirmed yesterday evening by Dr. Minter at Fort Bend County Department of Health and Human Services, and she's here, as well as the two cases that we are confirming today. The two cases that we're confirming today are individuals, as the judge mentioned, who are hospitalized, a man and a woman. They live in the northwest part of Harris County, in the unincorporated area outside of the city of Houston. These two individuals are in stable condition at a local hospital, which is good news, and we want to continue for that to happen. Right now, our main goal is to ensure that our epidemiologists and our public health team, working not just at Harris County Public Health, but across the region, including Fort Bend County and our City of Houston partners with Dr. Peirce and his team, that we do everything we can to determine who else may have potentially been exposed to these individuals. That's our #1 priority. As the judge mentioned, we have no evidence of community-wide spread at this time. However, what we do want our community to know is that, as we over time have said, that this is a concern that we have of what's happening globally, what's happening then domestically, especially on the West Coast, that eventually there was the potential that something would get confirmed here locally, and that is what's happening today. So I want to just reiterate that our message to the community at large is we want our community to continue to do all the things that they continue to do. They need to help us protect our community by covering their cough, making sure they wash their hands with soap and water, use hand sanitizer, and most importantly, if they are sick, not to go to work or school or to expose others. That is absolutely critical so that our community can help all of us, all the public health folks and all the regional partners do our job in order not just to investigate what's happening here, but also to make sure that our community remains protected and safe. The final thing I want to say is that this is obviously concerning to some individuals. When individuals hear this information, they may say, what does this mean to me? We want to emphasize that what this means to you is for you to be mindful that there are respiratory diseases out there, and we want you to do all the things that you can do to protect yourselves and certainly protect your families and those around you. Because these two individuals remain hospitalized, these two individuals are not in the community, and so these two individuals are not obviously exposing other people outside of where they are right now. And so with that, let me turn it over to Mayor.
Thank you, Dr. Shaw and Judge. It's good to be with you, and let me be very brief. One of the things that we wanted to make sure is that when we receive information, we wanted to make you available. What is the common denominator between the case in Fort Bend and the two cases here today in Harris County is that they were all on the same trip together in international travel. Those are the common denominators that exist, and I want to underscore that. Having said that, what I also want to say is that I'm hoping that and encouraging people to minimize, for now, their international travel. Not telling you not to. I just hope you will minimize the international travel, because for right now, for us, that's the common denominator. And we're trying to minimize the risk to all people in Houston, Harris County, Fort Bend, and people in the region. And that's one of the reasons, for example, that we decided to cancel several weeks and put it off for next year. The other thing that I would say is that we have the ability now, City of Houston, to test, and so we can do that now in 24 hours instead of sending samples to the CDC and having to wait 48 to 72 hours. So that's a big plus for us, that we have the ability to test right now in the City of Houston. The good news, in addition to that, is that other hospitals in the City of Houston are working to get up to the capability so that they can test themselves as well. And I've had the opportunity to talk to some of the doctors in the medical center, and they're looking to be able to do that. And that people are planning. We said from the very beginning we would plan for the worst and hope for the best. And so the planning has been taking place with the county, with all of the counties in the region, with our medical institutions over the last several months. This would be an excellent time again to engage in staycations. And let me say that, instead of people leaving the country and then coming back, especially with spring break coming up, instead of people going some other place outside of the United States, an excellent time to engage in staycations. Stay home, and take advantage of all of the attractions and the things that exist within Houston, Harris County, Fort Bend, the surrounding region. Certainly would encourage that, and we've encouraged our hotels, for example, to offer special discounts in the month of March, and they are doing just that. Let me also encourage our businesses, corporations, senior living facilities, nursing homes, schools, educational facilities, to have their own preparedness plan in place. That would be very helpful. And so instead of just waiting for there to be an expanded number of cases, right now companies, schools, universities, senior citizens, senior living facilities ought to have their preparedness plan in place. I'm not going to repeat all the other things you've heard about proper hygiene. I'm not going to go over all of that. But what I will say is that we are carefully monitoring all of the situations. We're working very closely with one another. We don't want to become paralyzed by our fear. So I'm still encouraging people to go about their business business, but to be very exercise common sense and good judgment, but to go about your business. Just like 50 of my executive team members with me to Asia Town and had lunch today. Great meal, good meal, and we are moving forward. And so, but what we wanted to do is to make sure that when cases are positive, that we provide you that information in a timely fashion, that we provide you with information that we have, because information is important, and we want people to know that we are doing everything within our power to make sure that we're keeping people safe in Houston, Harris County, Fort Bend, and the surrounding region.
Doctor, quick question. The folks that arrived presumably by an airline.
One second, please, 1 second. Dr. Purse, and then after Dr.
And then
Purse.
we'll take questions. We're going to speak, and then we're going to take questions. So let's hear from Dr. Purse. Yeah.
Dr. Purse.
Thank you. So I just want to reinforce a couple of things. Most everything of importance has already been said, but a couple of things I just want to put into perspective for people. So we live in Houston, Texas. We live in Southeast Texas. So one of the things that makes this community unique, in my experience, I've lived in New York, I've lived in California, I've lived in D.C., I've lived in a couple of other places. But one thing about this community that's unique that we need to pay attention to is that we have a very robust medical community here, very lean, the world's largest medical center, some of the brightest minds. We also have, because of our weather, we have faced weather disasters generally, that have taxed our healthcare system. And so we have a very tight relationship with the healthcare institutions in the community. And so while we're hoping for a mild impact from this virus, we are preparing like every other major metropolitan area across the United States is. But we have the added advantage of having gone through similar drills, if you will, with hurricanes and flooding that have stressed our healthcare system, and we got a very good working relationship, first name basis in many cases. Mayor Turner met with the CEO from the Texas Medical Center, and Dr. Shaw was there as well, and we met with the leaders of the major healthcare institutions several weeks ago, and so we've been coordinating with them for weeks. And so I think that people need to listen to what has already been said, and I would ask you to think of it in two ways. There's some things that we can do, and that we are doing those things, and we're doing them quite diligently and spending a lot of hours in anticipation, but there are also things that the public can do. And I want to remind you, I've said this a couple of times, but when we look at the other epidemics that we've had in the last couple of decades, they have ultimately been stopped because of a great coordination between the government and the people in the populace, and the people followed the advice, and that's how SARS and MERS and even Ebola, that's how they were stopped. And so as a community, not just the government, but as a community, a whole community, we are incredibly powerful and incredibly capable of having a huge positive impact on what faces us from this virus. And so with that, I'd say thank you.
Yes, questions.
I appreciate it. Yeah. So the question is, they returned home, these patients, obviously via some airline, and presumably with other area residents. Have those residents been notified? Have you identified the airline? What are you doing on that end?
Yes, so not only the trip back, but also, you know, where they've gone about their day before their doctor said, hey, wait a minute, you may have coronavirus. As soon as they knew and we knew, our epidemiology team reached out to them and have been, you know, making sure that they're self-quarantining. But of course, by then they had some contacts. So that is the work that Dr. Shaw's team has been doing, deep investigative work to identify all of the leads of people that we may need to give a heads up to, or even ask them to self-quarantine. So let me just make that clear, that even before this result came back positive, we have been going back up the pipeline and trying to map and trying to address what really happened. Of course, it's not easy, right? It takes a lot of work, but you have full teams of professionals who do this for, all kinds of diseases, working on this for you. So Dr. Shaw can fill you all in on exactly what that looks like.
Just to be clear, can you say assuredly that the people who were on that airline with these folks have been notified?
So thanks for that question. So I think what we have to just remember, as the judge said, is that we work as part of a system. So it's not just the local health department. It's working with our regional state health department. Dr. Carlos Plasencia is here, and working with our state government as well as the Centers for Disease Control and Prevention. And so what we're doing right now is continuing the investigation on individuals who may have been in contact with. I think it's important to remember, it's really important to remember that symptoms started well later. not early in the process. So I think your question implies when somebody may have initially walked off a flight, that individual may have had some symptoms or may have been now exposing someone else. And the truth is that our investigation is revealing that it was actually later in the process. So we feel comfortable right now, again, not fully confirmed because we're working again back through our federal partners. We feel comfortable that we have the right individuals. There may be more that grow in this number, but the right individuals that we have to continue to monitor and contact and assure that they are not additional cases for novel coronavirus.
We're listening in live to Dr. Shaw from the Harris County Public Health Department talking about the 2 confirmed cases here in Harris County, Northwest Harris County, one of the confirmed cases an employee at Rice University.
And the link here between 3 patients here in Harris County and the one out in Stafford is a trip to Egypt. The thing that they're stressing, though, this is a travel exposure, not a situation here in the States. We will continue to stream this press conference on click2houston.com and the very latest at 6.